So far so good. We can kill bacteria in a planktonic form. We can kill bacteria in biofilms with a similar structure to that we'd find in vivo. We can kill bacteria in biofilms taken from patients with chronic periodontitis. But what I want to do now is show a very important additional benefit of lethal photosensitization, something which antibiotics cannot achieve in general. These light-activated antimicrobial agents can decrease or can inactivate virulence factors of bacteria. Now, an antibiotic, when used to treat a bacterial infection, will certainly kill bacteria, but it has no effects on the virulence factors secreted or incorporated into the bacterium. So once you've killed the bacterium, these virulence factors will hang around and continue to cause tissue damage. These agents, as you can see, can inactivate virulence factors. This is a complex slide showing the effects of light and methylene blue on the proteolytic activity of Porphyromonas gingivalis. So we're using 670 nanometer laser light to activate this methylene blue. We're using 21.9 joules and different concentrations of methylene blue from 0 to 20 micromolar. And this is the activity of the P. gingivalis protease. And you can see we get a dose-dependent effect, and we can get considerable reduction of the activity of the protease. Now, this is something that most antibiotics cannot do. In fact, no antibiotic can do this. This shows the effects of varying light dose, the same kind of experimental setup. This time we're using a fixed concentration of methylene blue, and we're using different light doses. And you can see that we can get a reduction in the activity of this protease. The protease of P. gingivalis is one of its most important virulence factors. Interestingly, from a mechanistic point of view, if you carry out these experiments in deuterium oxide, we get less activity, and we get greater reduction in the activity of the protease. If you carry it out in a single oxygen scavenger like L-tryptophan, you can see that we get far less destruction of the protease. It's just backing the mechanism that we proposed. Now, another important virulence factor is the ability of P. gingivalis to hemagglutinate red blood cells. One of the most important factors that limits bacterial growth in a human being is lack of iron. And many pathogenic bacteria have iron scavenging systems. And the first stage in the iron scavenging system is to try and hemagglutinate, so agglutinate the red blood cells to make them more readily to scavenge the iron from these. So it's an important virulence factor. And this shows the effects of methylene blue, different concentrations of methylene blue, irradiated with laser light on the hemagglutinin activity. And you can get almost complete abolition of the hemagglutinin activity of P. gingivalis using an appropriate methylene blue concentration and light dose. And this is the effects of different light doses on the hemagglutinin activity. Again, choose the right light dose and the right concentration, and you can almost completely inactivate the hemagglutinating activity. No antibiotic can do that. We've also, a very important virulence factor of P. gingivalis is its lipopolysaccharide. Lipopolysaccharide, or endotoxin, is a component of the outer membrane of P. gingivalis, and in fact of any gram-negative bacterium, and has very, very potent pro-inflammatory effects. And this certainly contributes to the tissue destruction in many chronic diseases, including periodontitis. And we found that we could get a 4-fold decrease in the lipopolysaccharide activity of P. gingivalis by using methylene blue and laser light. Now, this is really incredible. Lipopolysaccharide is a very stable chemical. It's a complex chemical, and it can withstand autoclaving. So you can heat it up to the usual autoclaving temperature, which will kill bacteria, has no effect on the biological activity of lipopolysaccharide. In order to get rid of lipopolysaccharide, you have to use 25 molar sodium hydroxide, and you have to heat it up to about 250 degrees centigrade. And here we have a very, very simple way of activating lipopolysaccharide. Very important indeed.